Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. Today, I'm going to be spending some time with you talking about constipation. We're going to be looking at what constipation is, some causes of constipation, and some things that you can do to help treat and prevent constipation. Constipation is a common condition that affects people of all ages. Severity can vary from person to person, and for some people, it can last for a short time. For others, it can be long-term or chronic. Not having a bowel movement every day is not considered as constipation because everybody is different, and some people have more frequent and regular bowel movements than others. Constipation can have an effect on your quality of life and can cause significant pain and discomfort. A person is considered constipated when they have not had a bowel movement for at least 3 times in 1 week. When the stool is often large or small, when it is dry, hard, or lumpy, when there is straining or pain when you have a bowel movement, sometimes bloating and a stomach ache, and also needing to use manual movement to achieve a bowel emptying. Example, using your hands to press your abdomen or using your fingers to remove stool from the rectum. When you're not passing stool regularly or unable to completely empty your bowel. So now let's look at some causes of constipation. Not drinking enough fluids, especially water. A change in diet or daily routine. Example, a change in eating habits. Inadequate movement of the body, and this includes spending long periods sitting or lying in bed. Stress, anxiety, and depression can also cause constipation, and often ignoring the urge to go to the toilet. Not eating high fiber containing foods like fruits and vegetables can also cause constipation. Constipation can also occur as a result of a side effect of a medication. And some of these medications include aluminum containing antacids, some antidepressants, some drugs used for the management of epilepsy and mental health problems, opioid containing painkillers, example, codeine and morphine, diuretics that are used in the management of high blood pressure, and examples are furosemide and vendroflumetazide. Also, iron containing supplements can cause constipation. Pregnancy can also cause constipation, and it is estimated that about 2 in every 5 pregnant women experience constipation, especially during the early stages of pregnancy. And this results from hormonal changes that occur during pregnancy. And in children, poor diet, fear of using the toilet, and problems with toilet training can all lead to constipation. Rarely, constipation can result from an underlying medical condition, and examples of such conditions are irritable bowel syndrome, diabetes, hypothyroidism, spinal cord injury and anal fissure, Parkinson's disease, and bowel cancer. Diagnosis of constipation is based on symptoms and bowel habits, and there is a chart called the Bristol stool chart that helps with the diagnosis. If your stool is a type 1 or 2, then you're possibly constipated. The ideal stool is type 3 or 4. So how can you treat and prevent constipation? Tip number 1, include plenty of high fiber food in your diet. That is, eat more beans, more vegetables and fruits, whole grain rice, pasta and brown bread, seeds and oats. Apart from the fact that these foods make you feel fuller for longer, they also pass through the digestive system more easily. Tip number 2, Cut back on foods low in fiber, example cheese, meat, and processed foods. You should always balance these with high fiber options, as these can cause irregularities in your bowel movement. Tip number 3, drink plenty of fluids, especially water. Drink between 6 to 8 cups of water a day. Avoid alcoholic drinks as they can cause dehydration. Tip number 4, get some regular exercise, at least 30 minutes a day. You can do some running or walking. Exercise can improve your mood, make you feel healthier, and improve your general fitness. And in addition to that, it would increase the intestinal muscle activity and cause your bowel to move. Tip number 5, create a regular schedule for bowel movement. Also, listen to your body. Do not ignore the urge to move your bowel. Anytime you have the urge to go, do not delay, just go. And anytime you go, take your time. Do not feel rushed. Tip number 6, to make it easier to move your bowel, try resting your feet on a stool whilst going to the toilet. If possible, rest your knees above your hips, as this makes passing stool easier. Tip number 7, if the medication you're taking is causing constipation, then speak to your doctor or your pharmacist so they can carry out a medication review with you and make the necessary changes. Tip number 8, for children, especially those who have just been started on solid food, make sure they get plenty of fiber in their diet. Encourage the drinking of apple, prune, and pear juices, as these naturally contain sorbitol, and sorbitol acts as a stool softener. Tip number 9, manage stress. And I'm going to leave the link for my video on useful tips for managing stress in the description box below, so you can check it out. And tip number 10, when dietary and lifestyle changes are ineffective, then you can try laxatives. Laxatives are available to buy from your local pharmacy. Laxatives are effective in helping you move your bowel, and there are various types. And make sure you speak to your pharmacist, who would help recommend the right one for you. We've got the bulk forming laxatives, and an example is espagula husk. They work by increasing the weight of your stool and then stimulate the bowel to contract naturally. They have a delayed onset of action, so not suitable if you require immediate relief. They also require an adequate fluid intake to avoid intestinal obstruction. We've also got the osmotic laxatives. An example is lactulose. They increase the absorption of water into the large bowel and can take up to 48 hours to be effective. Another group is the stimulant laxatives, and examples are Senna and bisacodyl. They act by increasing the movement of the intestines, and they work within 8 to 12 hours, so they are best taken at night. We've also got the fecal softness, and examples are docusate sodium and glycerol. These work by allowing an increase in the penetration of intestinal fluid into the feces. Docusate sodium has also got stimulant properties. At this point, I want to talk about some symptoms that when you experience, then you would urgently have to visit your doctor. And these include when your stools are bloody, when there is a swelling in the rectal area, when you experience abdominal pain and fever, and when there is unintentional weight loss, when you're passing mucus and there is nausea and vomiting, also when you get a high fever, and when there is worsening pain in the rectal area, and there is rectal bleeding unrelated to bowel motion. So today, I've spent some time with you talking about constipation. We have talked about what constipation is, some causes of constipation, and things that you can do to treat and prevent constipation. We have also looked at some alarming symptoms that you urgently need to report to your doctor. I hope you have learned something today. If you have, then please give this video a thumbs up. Please share the information with family and friends. And remember to leave your comments, your suggestions, and your questions in the comment section. If you haven't yet subscribed to this channel, please don't hesitate to hit on the subscribe button and also on the notification bell so you don't miss anything that I upload. Thank you once again for joining me today, and I hope to see you soon in my next video. Bye for now.